on our own as well. So there we are. Welcome, everyone. Thank you for being here. We'll let some more folks in. Looks like we're going to have a great group today. And now is a great time while we wait to officially get started to just make sure that your name is accurately reflecting who is attending the meeting. And feel free to also add your pronouns and take a moment in the chat box to introduce yourself as well and share where you are calling in from, where you are zooming in from, and a little bit about your role in the work that we're all doing. And if you're here as a parent, welcome. Thank you for being here. Also want to know what your role is as a parent too. And as far as cameras on or off, it's really great to see faces since this is a connecting and networking meeting. We ask if you can have your cameras on. The first couple of minutes, I will be giving an update. So folks might be mostly looking at the screen anyway, because I'll be sharing my screen. But once I stop sharing the screen and we all have a chance to connect with one another, it will be really lovely to have cameras on if possible. Okay, so I'll continue to kind of keep an eye on the waiting room here. And I will start to share my screen momentarily. First, I'll introduce myself. My name is Kara Kaikini. I use pronouns she, her, hers, and I'm the Executive Director of the Maine State Breastfeeding Coalition. And I'm really glad to see all of you here today. So thank you so much for making the time. And let me go ahead and share that screen. Okay, so this is, hopefully you can all see, I'm not actually seeing what screen it's showing. Hopefully you're all able to see the agenda. Is that what everyone's seeing? I'm seeing some heads nodding. Okay, my screen changed here. So this is a document that is something that we use every meeting, and it's called our New Knowledge Worth Having document. And this is where I keep notes that I want to be sure that I'm sharing during the meeting. It's also open so that anyone can also add to it. So if there's any resources you want to share, anything that you think the rest of us would want to know that you want to share in addition to maybe sharing it out loud during the meeting, this is a great resource that everyone can have access to during the meeting and after the meeting. So I'll go through my notes that I have here and just run through what the agenda plan is for today. So we'll start by, again, welcoming you all here, reviewing the agenda, which will include the next 5 to 10 minutes probably of me giving an update on essentially going through this document, sharing some new resources that we have for you all to know about, and explaining the next part of our meeting, which will be the connecting the dots. So this is where you'll all have a chance to introduce yourself and share what's happening in your world, what is happening legislatively. Happy to have the opportunity to make the opportunity today for you to share how you're doing this week in general after the results of the election. Some of, we don't need to get political, except this work is political. So we do need to talk a bit about what we are, how we're feeling about what's next in our country and in our state, and what kind of legislative impacts might come about or that we are already experiencing now. So we can have a chance to talk a bit about that. And also any other updates that you have. If you have any questions, if you're looking for resources, that's what we're all here for, to help share resources and answer those questions. Or if you're having any challenges in your workplace that you could use some support from your colleagues here, this is the opportunity for that. Okay. And then we'll wrap up if we have a few minutes, which we usually don't, especially when we have such a great turnout like we do again today. We may have a moment to kind of share what our takeaways are from the meeting, and I'll also just kind of go through upcoming meetings in this update as well. So again, hopefully you're all able to see this. I think most of you are familiar with our organization already, but otherwise, I will let you know that we have these wonderful committees that are full of volunteers, and we're always looking for new volunteers. We've had a number of people answer that call recently and have reached out saying that they want to volunteer, so thank you for that. Sometimes we're able to plug you into a committee to support the work we're doing, and sometimes we have other tasks that you can help with. So I will try to get the volunteer link into the chat box after this, and so that you can see how you can sign up to volunteer. So some of the committees we have are an advocacy committee, we have an events and fundraising committee, workplace, DEI, communications, professional development, and we also are creating a subcommittee of the professional development committee that is our conference planning committee. So we are planning, we're starting the process of getting a conference on the books for next fall. We're still in the process of finding the right time, date, and place, but we're very, very close. So stay tuned. And we always have ways to donate. So just want to always make sure that's clear, that you can donate at any time through our website, through sending funds through Venmo, through Facebook birthday fundraiser. So if any of you are on Facebook and you have a birthday coming up and you want to consider the Mainstay Breastfeeding Coalition a beneficiary of your birthday fundraiser, we're always happy to be that opportunity. And it's really, really easy. I just had my birthday in October and raised almost $300 just by sharing it a couple of times. So that is all really, really valuable. Any sort of amount, and like we say, every drop counts. So we like to do that. As far as resources, hopefully you've all seen this LGBTQIA2S+ resource for professionals. We have this on our website, and I can easily copy and paste this link here and put that in the chat. If you haven't seen this yet, I highly recommend you check it out. It's something that we made, our DEIJB committee put this together. And it's a fantastic resource if you're wondering about how to best support these families when it comes to lactation and infant feeding. So definitely check that out. And resources that we've continued to have in this document, we have perinatal bereavement resources. We have our resource library that is continually being updated. And we have a volunteer who has, I don't know if Alana is here right now or not, but who has been going through our website to make sure that our links are up to date and are working. So we have some edits we need to make, but if you ever see anything like that, please let us know. And we are happy to make sure that that is updated. So again, if you want to be able to click on any of these links that I'm talking about, here is the document that I'm referring to. Just put that in the chat box again. Also, Zip Milk. This is a resource it's a resource directory. It's a provider directory. So if you're not already listed on here, I think anyone who is in this meeting here could probably be considered in one of these categories here. So these are the listing categories you can select from when you create a listing. So I hope that you all do this. We have 17 listings right now throughout the state of Maine, which isn't bad, but I know there are more out there. There are more resources out there. And when we want to be sharing this resource with parents, we'll be giving a presentation next week. I didn't put that in here, but you may have seen in our email. I'll be moderating a panel with Paula Norcott and Dr. Kelsey Walton in a webinar that is being co-hosted by the Maine Public Health Association and the Maine chapter of AAP. And we want to be sharing that resource. The Zip Milk is a resource directory. A lot of these providers want to know how they can connect with lactation professionals around the state. And hospitals can be great resources, but we know that there are so many more resources out there. Zip Milk can be one location that they can always go to and say, tell their patients to go look, enter their zip code or search by state and find these resources. So really, please, please, please take a moment to add your listing to this. Okay. I'm going to add some more folks who are in the waiting room. And then as far as legislative updates or advocacy, we do have our advocacy committee that has been pretty focused on paid leave. It's also been focused on on other things I'll get to here. I'm not sure if Katie, I do see Katie is here. So Katie, hopefully when we come around, you can give any other updates on paid leave. That would be fantastic. But we do always have this resource here in our to mainfamilyleave.org and the PFML page on the Department of Labor site. We also want to mention the Maple survey, and I know that Brianna is here, so she'll be sharing more about that, but that is available. It's also been in our newsletter, the last couple of newsletters, so we really want to encourage you to tell the families you work with about the Maple survey so they can be sharing their experiences and informing the research that's being done about that. As far as the Maine Doula Coalition, I see Sarah. Hi, Sarah. So hopefully she'll be giving an update, but I'm just sharing that there is a new Maine Doula Workforce Assessment. That's a link that, Sarah, if you have that handy, go ahead and drop that in the chat. It is also here in this document, and maybe Sarah will speak more about that. As far as donor milk goes, they're always in need of donations. So any families you work with, again, just let them know that if they have extra milk and they're considering donating, that donating through the Mother's Milk Bank Northeast is a really fantastic way to do that. And I've also been in touch with Maine Care. I don't know if you know that Maine Care hired someone who is the maternal child health. There's a maternal child health position at Maine Care right now. And her name is completely leaving my mind right now. It will come back to me. Some of you may know her, but she's been reaching out to ask about, she wants to create an educational document that shares information about what Maine Care covers in terms of lactation support. So supplies, donor milk, etc. And we're also talking about how to advocate for Maine Care coverage of lactation support outside of the hospital. So stay tuned on that. Mitchell, I see you are here, and I know this is something we've talked about before. So while I have you for a moment, I'm wondering if we had talked before about reviewing what other states are doing, because that's their current ask of us right now. That's something maybe you and I can connect on some more.
Yeah, let's connect because I also just had a conversation last week with Maine Care and this week. I have a provider locally here in Bangor that wants me to kind of come work with her, but Maine Care is still fighting on like how they're going to do that because they cannot list me as a rendering provider. So it's a big deal. I've been working with them, working with this provider here. So definitely would love to connect with you more on that. And I have a ton of information
Okay,
as well.
perfect. Awesome. Thank you. So everyone else, if anyone else has experience with this, I know there are some states where there's licensure of lactation consultants. And Emily, I see you are here, Emily Sylvester. And I don't know if you know about this in Massachusetts or not, or who else might be familiar with licensure of lactation consultants in other states. I'm not sure if that's what happened recently or not. But anyway, if you have more information, please share, either email me or share during our sharing time. Then the other big resources that hopefully you've seen again in our emails or on our website are these workplace support tools. So go to our website, mainebreastfeeds.org, and you'll find our Returning to Work Toolkit for parents. And we are very close to releasing these in Spanish, Portuguese, French, and Arabic. So that is really exciting. They've been designed in the same way. We're waiting for the final approval to release those. So stay tuned for that. And then last month, we released our workplaces, resources for workplaces to support their lactating employees toolkit. Check that on our website as well. And share them with any sort of workplace you know, okay? Even if it's not through your professional networks, share them with your personal networks, anyone who might be a business owner or who might work in HR or as a manager. How can you provide this information to them? And could they apply for recognition? through us. So we have developed a Maine's lactation-friendly workplace recognition program, and we need some workplaces to recognize. So we've reached out to quite a few, but really what is most impactful is having that one-on-one relationship or connection with a workplace and kind of walking them through what this might look like, which is essentially having a policy in place that ensures that time and space are given. Really, it's having a policy in place that is showing that they're following the law. So we aren't asking much more than that, but if they're doing more than that, we want to recognize that and showcase that as well. Sometimes people share job opportunities in their work, and we're always happy to share that out in these meetings and also through our newsletter. We can do that too. So just wanted to let you know about that. Our next educational webinar is December 5th. We have Brianna Bryant, who will be talking about cannabis, pregnancy, and lactation. So we always know there's good information to learn on that topic. You can register for that. And some of you have had questions before. In the past, we have offered our webinars for free. We hope to get back to that. But there are costs associated with offering these webinars. And so we had to make the decision earlier in the year to charge for these, which is really whatever you can pay. $1 is fine. If you want to donate and pay $20 because you find that's something you can do and you find the value in that, then please do that. If you have any trouble with this, please contact us and we can work with you as well. And then that professional development committee that we have started is looking for topics and speakers for webinars for 2025. Please reach out and let us know if you have any ideas. The topics are usually very easy to come up with. It's the speaker associated with that topic who is available and we can connect with. So we really want to hear more about that. Also know that our webinars are always recorded and our meetings and are available on our YouTube page. And then 2025, unless anything changes, this is our schedule for our meetings next year, continuing with every first Thursday of every odd month from 12 to 1. And I say, that unless something changes, that's what we are planning, because we are starting a strategic planning process right now. So looking at a new strategic plan going forward, and that will mean getting input from all of you on what you would like to see us doing. Do these meetings work for you? Do the times work for you? These are questions that you can expect coming in your direction shortly. And then the last note, this is something that you would see on our website. We'll be sharing this out in the next couple of days to potential sponsors for our organization. We also like to call them partners, but essentially they would be supporting our organization financially. And that has been tremendously helpful for our organization in the past. And we have a package that can be found on our website for people to look through. So if you know of any, if you are a business or are connected to any who you think would want to support our mission and our organization, then please share that with them. Okay, that was 19 minutes of information. Thank you for hanging in there. We have a great group of 40 people, so I want to make sure that everyone has a chance to share your thoughts on any of these questions or what I started the meeting out with, which is just how are you doing in general? How are you feeling about the state of our work and the current state of our work and the potential future state of the work that we do supporting new families in Maine? And some of you might be from beyond as well. So with that, I put the questions in the chat box. I'm going to take a minute to review what's been happening in the chat and open it up for anyone. So hopefully you all are familiar with the hand raising function, because I think that's what we're going to do today. Instead of going through the attendee list, we're going to give each person an opportunity if they have something they want to share. Some of you have reached out and I've already identified a few of you. I know some of you have things that you want to share. So if you can raise your hand, that might be the best way. And that would be through the hand raising function, which I honestly can't find on my end. You could also maybe type in the chat that you have something you'd like to share and I will see that as well. Otherwise, I see Brianna right now, and Mitchell, I see your hand up. So we'll start with Brianna, and then we'll go from there. And this is all, like I said, a great time to have cameras on if you are able to, so that we are feeling that sense of being together.
Thanks, Kara. Hi, everyone. It's nice to be here. This is my first time at a meeting, so that's great. I'm really happy to meet you all. My name is Brianna Kiefotes. I'm a postdoctoral researcher at the Rue Institute based in Portland. And as Kara mentioned, myself and my colleague Louisa Smith are doing a study kind of in collaboration with the Maine Women's Lobby and the paid leave group um, to study first and foremost people's experiences with paid family leave or just family leave in general and postpartum health. What we're doing right now is a pilot study. So we're trying to get about 200 responses from people around the state about their experiences with their health and their child's health in the first 12 weeks after the baby was born, as well as their experiences working during their pregnancy and kind of whether they worked or not after their pregnancy. So really just understanding kind of in Maine, what are people's experiences in those first 3 months as far as their health, their children's health, and their experiences with any parental leave they may or may not have had. And our hope eventually is to do a larger study to compare people's experiences before the paid leave program goes into effect and then after. Um, that, that will happen in 2025 and 2027. It'll be much larger, but right now we're just trying to recruit folks to do this small pilot study so we can really get the survey going, get a little bit of data, and figure out the best way to expand our study. So one of the things that we have been asking folks is if you have like a list serve where you might be able to share the study materials, and I can share them again. Kara has the materials as well. If you have a listserv like that you could send them out, that would be wonderful. We've had good success there. We were posting on social media, but got so many fake responses that we're kind of not posting on social media anymore. It's just to share some numbers. We have 8,000 responses right now, and clearly that's not all from folks in Maine who have babies. So we're trying some other ways. Next week, we're also going to go out with some interns and post flyers around Portland and potentially kind of like within an hour of Portland. So if anybody knows of any places or like you have a support group that we might be able to come to and hand out flyers, that would be great. We're really asking for like low lifts at this point. Next year, if we get funding to do the big study, I'll be much more kind of reaching out multiple times, see if we're really hoping to get further up into Maine as well. But right now that's what we're looking for. So if anybody has ideas or questions, I'll put my email in the chat and can certainly send you the materials as well. Thanks, Kara.
Awesome. Thank you, Brianna. And I'm not seeing that showing up as a link. I don't know if I need to add www to the bit.ly link, because I realize it doesn't look like it's hyperlinked on that document, but we have
That's a good
QR
that's
code.
a good question. You know what? I will, while we're here, I'm gonna make a very quick Google folder with the flyer, and then I can just share that link with everybody.
Awesome. Thank you so much. All right, Katie, I see your hand up, and Lynn had some questions around paid leave and if there's a link to explain what's included. So, and sorry, Mitchell, I'll come back to you. Thanks for raising your hand again.
I'm fine
Katie.
to wait if Mitchell needs to go for, I have time, so I'm happy to go.
You're welcome to go. I also have time, so I'm not in any hurry.
Okay. Yeah, I see that Lynn has a question about paid family medical leave. So my name's Katie Reed. I use she, her pronouns. I work at the Maine Women's Lobby. And we convene the Paid Family Medical Leave Coalition in Maine that Kara was saying the Maine State Breastfeeding Coalition is a part of, a very active member. So we're thankful for all of you being able to get those updates and plug in where you can. Yes. So the short answer is yes, it starts in January. But what starts are employee and employer contributions. So people starting in January will see deductions coming from their paychecks, and employers will have to send those into the state, and they will go into the Maine paid leave fund, the paid family medical leave. fund. So that is just something to be aware of that's happening. The current contribution rate is set at 1% for employers that have more than 15 employees and at 0.5% for employers that have less than 15 employees. So small businesses don't have to pay that full percent. If you are a self-employed person, you have an option to opt into the program, but you would not automatically be opted in like you would if you were at a business. And that 0.5% for small businesses and half, so 0.5% for businesses paying the full one, can come from people's paychecks, from their salaries. So that is how it's split between the employer and the employee, unless it's a small business, and then it's just could just come from the employee. And so I'm going to put the Maine Department of Labor is doing a lot of work to try to get as much information out there for folks as possible. So I'm putting the link to and I see, Kara, you already put that in, but there's a link directly to the state of Maine's website, which has a bunch of resources on it. Some new resources that they recently put out for folks are a labor law poster about the program. So if you are a employer or work with an employer who might need to add that, make sure that they have that information and that they're putting that information up for folks. There's also a one-page document about what employers need to know about contributions that kind of lays out all the details pretty clearly. And then there are some webinars that you can download the PowerPoints that they used for those. They were educational webinars for workers and employers. And so you can watch those. Those are recorded and on their website as well. And you can also get their PowerPoints that they use for that, which talks about how much those contributions really look like. And 0.5% of your salary really looks small when you think about it over time. So they do show those rates for folks. And it's I know it's significant and at the same time is really manageable, because what you would be getting for the time off really would make up for that. I'll also say that benefits will not be available until May of 2026. So this contribution period will happen for a period of time because they have to build up the fund. It's not like when you put this contribution in, it goes anywhere else. It goes to the paid family medical leave fund. And so that needs to be built up before people can start taking their time away from work and get that supplemental benefit when they do it. So that's where we're at with that. Yeah, I'm happy to answer questions, or if folks really want to be involved with the Paid Leave Coalition, please feel free to reach out.
Thanks, Katie. Does anyone have any questions? And I'm curious, has anyone been hearing anything about this outside of the Breastfeeding Coalition? Or if you are connected to the Maine Women's Lobby or the Paid Leave Coalition, are you hearing anything else out there about paid leave in Maine? Mitchell, you've had clients ask if you know anything yet. Okay. All right, that's good to know. And I think that that's like some of the next steps, as Katie mentioned, is to make sure we get the word out about it as much as possible. Okay, Lynn, so parents are asking at Centering about it. Yeah, that makes sense. If the parents heard that this passed and they knew what timing they might be having their babies, and if the timing will work out for them to be able to use it. So that's great that we can have some information to share with them and hope that the timing works out for them.
And we're happy to do discussions with folks, so if you have a group that meets regularly and you want to have a 5-minute discussion, or even a longer discussion about paid family medical leave and Maine's paid family medical leave program, please feel free to reach out to us. We'd be happy to join.
Right, thanks. Do you see this question from Aaron? If used, is it only paid at average wage, not their wage? Correct. What is the average?
Um, does that, Lynn, can you clarify that for me before I answer?
Let's see where that went. Oh,
Um,
Erin, it was the one that
Was
asked that.
Aaron.
oh, Aaron, yeah, sorry.
Yeah, I mean, and it
That's
sounds
okay. I'm just a small business owner, so I've been hearing lots about this and uh definitely is going to you know it's coming and gonna affect, but what I'm hearing is that if once it's able to be used May of 2026, it will be only based on an average state wage. So each
No.
employee that has different earned wages, hourly or salary or whatever, it's not based on that, it's based on an average. I was just wondering if you clarify that.
Yeah, thanks for clarifying that question. It is actually based on everybody's individual income. So everybody taking leave will have a benefit payment that is based on their individual income rate, like what their salary is. So it's half of the formula is based on the state average weekly wage, which right now is like a little over $1,000 a week. So let's say you make $1,500 dollars or let's say you make $1,000 a week. Half of that, so $500, is going to be replaced to you at 90%. And then the additional $500 is going to be replaced you at a 60% wage replacement. So it's like a staggered wage replacement. So the lower, like half of the average weekly wage comes back to you, and then any income you have on top of that is going to come back to you at a slightly lower rate, if that makes sense.
Yeah.
But it is based on your income. So if you're making more than the average weekly wage, then it would change how much you would get back to you. But it's a little complicated because they do that. It's called a progressive wage replacement because it is higher, sort of the lower amount that you're bringing in.
Yeah, it's complicated. There are a
Yeah.
lot to it from the employer side and the employee side. So I think, like we said, there's lots of room for education and opportunities. And Katie is very responsive and happy to answer any questions by email or phone and to come to meetings, like she said. So I think I would definitely take advantage of the amazing resource we have in Katie and the Maine Women's Lobby and the Paid Leave Coalition. All right. Thank you, Katie. If anyone has more questions, feel free to use the chat box or connect with Katie. And if we have more time, we can revisit it. Mitchell, I'll go to you. Thank you for waiting.
I'm Mitchell, she, her, hers. I live in the breast life here in Brewer, Maine. I am an IBCLC, a child passenger safety technician, and currently finalizing all of my stuff to be a certified labor and postpartum doula. So a few updates of what I am working on right now is getting more insurance coverage through my business to cover the IBCLC portion of things. So as of December 15th, I'll be fully credentialed with Community Health Options, and Aetna will start their predicting in February. I'll be credentialed with them. I'm heavily working with Maine Care, trying to get any sort of loophole that I can find to see if there's some way that I can also benefit and help those families. I know we have a lot of lower income programs available in Maine, but I've heard feedback from several different, moms that they really wish that they could have more resources available to them without the stigma of like their insurance being a thing. So I am working on that. If you have anyone in Maine or if you are also working on that, I'd be more than happy to connect with you. That way we're not, doing the same job twice if we're both working on the same thing. And then something else that I'm working on is with the local providers in the hospitals to kind of give them education on why they should refer to an IBCLC or even to a CLC, and how these services can actually really benefit them in their practice as well. I'm having a lot of really good luck with some of the smaller facilities, but not so much with bigger ones. So if you know anyone that works for any of the larger Bangor area facilities, I would love to talk to them and kind of see how we can go about that. I'm also available to do, I have like a 30-minute presentation to give to physicians that basically just explains what I do when I go into the home, what I'm capable of sending to them, what expertise I have, things like that. And really trying to make sure that we as lactation educators are getting the information where it needs to be so that we can educate overall.
That's great. Thank you, Mitchell, for sharing that and for all the work that you're doing to advocate for breastfeeding support. And in the latest newsletters we've sent out as well, I've shared that the United States Preventative Task Force has created draft evidence to support breastfeeding interventions. And I'm putting that link in there. This is a time for folks to review it and give comment on it if you want to. And they have specific questions that they ask when you click on the process of giving comment. It is a really long document, as these documents tend to be. There is an abstract that you can look at to get a feel for what the idea is. The grade level that they're giving this recommendation right now is a level B, which is really excellent. Grade levels A and B tend to get most attention and support and carry more weight when it comes to the recommendations. So the recommendations are essentially that providers should be giving information and support around breastfeeding and referring and recommending more support in a very simplified summary of what their recommendation is. So it's nothing new to us. It's really supportive of the work that we do. I haven't had time to read each page of this and to dig into the research that they've chosen to review. But know that that's out there. And so, Mitchell, that's something you could add to your presentation too. In the presentation I'll be giving next week, I will be adding that in there, that there's a lot of evidence showing how important lactation support is. And there are reasons why we want to provide this support. There are reasons why the recommendation is to provide human milk. And we also know that there are reasons why it's hard. There are a lot of reasons why it's hard, and we need to boost up support and systems to make it not so hard for these families. So it's funny. I don't know if you all see that in the chat box, that it's quiet in here. The AI person is saying it's quiet and that they're going to leave. Is it quiet? Is it not? I don't think it's been quiet. I feel like we've been talking quite a bit. Thank you, AI, for being helpful most of the time. So, okay, Casey, I see that you just dropped something into the chat box. So would you like to go next and sharing what that is?
Oh, sure. So I work for Maine Health Community Health Improvement Team, specifically in York County, on healthy eating, active living initiatives for obesity prevention. And one of the things that my team recently created was this brochure, which we are now in the process of like sharing far and wide. We did just have some printed too professionally, and they came out great. But anybody who's
yeah, I tried clicking on it and it says I need to request access.
Okay, I'll have to try to share another way, because I was trying to put in my original way and it wasn't letting me do that either. My computer did an update this morning, so it's being weird.
I did request it, and like if I can access it, I can happy to share my screen to show folks what you're referring to, and I could probably give you access to share your screen too if that's easiest.
I can share if you want, because I actually have it right here.
Let me just make sure I get to that. I'm going to make you co-host so that you're able to share your screen.
Closing both of our AI note takers.
I know. I wonder what's going on. If there's something on my end that's making it so they can't hear. I don't know.
Just see if I can. There we go.
Yay.
So this is the brochure that we created. It's York County Pregnancy, Breastfeeding, and Infant Support. We worked with the WIC program and Maine families, just to kind of have lots of eyes looking at it and making sure that we didn't miss anything, which I'm sure we probably did despite those efforts. But we have a whole page dedicated to the WIC services and what they provide, links to the Be There For Me, Maine State Breastfeeding Coalition, and all of the great resources you all have. And then we also have Kids Free to Grow, Cradle Me, Baby's Blessings is something that's specifically in Sanford, public health nursing, home health visiting, and Maine families, and then the hotlines that are at our Biddeford Maine Medical Center. So again, that's in its final version, so feel free to share it. I will try to get you an actual copy that we'll share. So yeah. And then the other piece that I wanted to share too is we have an early child care and education conference that's going to be coming to the Sanford Regional Tech Center, Sanford High School on April 26th, Saturday. I have a save the date I can share for that. And then I also have a request for proposals. And I thought I would mention it here because there's amazing opportunities to be a vendor there, as well as a speaker if there's a session that anybody's looking at sharing. So it's going to be all early care and education professionals, generally from York County, Cumberland County. We may get a couple that come up from New Hampshire. The last time we did it, we've been making it an annual event, but we did have to cancel it last year because of the Lewiston incidences. But the year before that, we had over 150 providers that came, and we're anticipating it to grow even more. And we had a gazillion vendors lined up down the hallways, sessions galore. So anything that comes to mind, feel free to submit the request for proposal, and we're happy to consider you being there. And Kara, I'm going to connect with you separately because I have all kinds of ideas on how we can potentially partner with you if there's capacity, or just kind of share my ideas in general. So.
Okay, that's excellent. This is something that I wouldn't be surprised if it comes up in our strategic planning process, like kind of shifting a focus, continuing to support workplaces, of course, but shifting a focus possibly to early childcare and education centers and so on. So yeah, happy to talk about that. Where is that conference? You said April 26th?
It's going to be at the Sanford High School, the Regional Technical Center. We partner with their early care and education program. They have their students involved, the instructors involved, and so it's right there.
That's awesome. Thank you. Does anyone have any questions for Casey? All right, that's awesome. Thank you for sharing that. That brochure is really exciting and well done. Canva is pretty amazing, and also I was talking to someone this morning about how it's so awesome and also takes a lot of time.
It does. If I can't figure out how to get these into the actual chat, I'll email you the hard copies. And then if you want to share them far and wide, that'd be great.
All right. Thank you.
Thank you.
All right. Who else would like to share something or ask a question? Sarah, yes, thank you.
I don't have a hand raise button for some reason, so I always have to just raise my hand, which also seems fine. My name's Sarah Tui. I'm the chair of the Maine Doula Coalition. I recognize a whole bunch of you here from other meetings and groups. But I just wanted to say hello to everyone. This is like Brianna, this is my first time at one of these meetings. We just finished the first ever workforce assessment of doulas in the state. And I posted a link to where that document can be downloaded in the chat. So there's lots of great information there that we collected through surveys and an interview series of who doulas are in the state, where they are, what their needs are, what kind of struggles they're finding in their work and in their communities. So that's there as a resource for people now who may have questions about doulas or anywhere that lactation and infant feeding work is sort of intersecting with doula work in their lives. So we're working right now to expand access to doula services into Maine Care and hopefully also into private insurance. And one way or another, I think that will be happening in the state within the next couple of years. There's really broad-based support through all kinds of professional organizations and state agencies for expanded access to doula care. So that's what we've been up to recently. I'm very accessible if anybody has questions about what we're up to or about the doula community in Maine in general. Always feel free to reach out.
Thank you, Sarah. I don't know if you put your contact info in the chat as well.
Sure, I can do
If you
that.
could. Great. Does anyone have any questions for Sarah? It's exciting work, and Sarah's done such a great job of leading this work over the last year or two or longer. So to have a workforce assessment like that is really, really important and helpful for all of these initiatives going forward. So nice work, Sarah.
Yeah, I mean, I think we needed information on the doula workforce in Maine and it didn't exist. So we went ahead and collected it. And I think I don't know if anything like that has been done for CLCs and IBCLCs in the state, but certainly something to think about because I think that having that information about the doula workforce to actually hand over to Office of Maine Care and hand over to Maternal Child Health at Maine CDC, it's really powerful for them, I think, to have that data about our professions and also to have that lived experience testimonial from people that are within the workforce. So something to think about maybe for the lactation professional community.
Yeah, we know that we'll be learning a lot from you throughout this whole process. So yeah, thank you. What else? Who else? We have a great group here. Whether you have updates or questions or thoughts or feelings, this is a safe place to share and ask. And while you think about whether or not you want to say something, I will call on Lynn in case you are available, Lynn, to ask a question that you had emailed me about earlier.
Oh, thank you. So had a mom reach out to me for help this morning about sleep issues. She has a 5-month-old and they have been co-sleeping and she's exclusively breastfeeding. She hasn't started solids yet and she's working, but she's able to feed her baby. She works from home and feeds the baby. So I was trying to figure out, well, sometimes there are reasons why babies like, well, this baby wasn't waking for feeds every 20 minutes to like every 2 hours all night long and had been sleeping for a 4-hour chunk. And sometimes we'll still sleep a small chunk and then up every. So I had remembered that there used to be a sleep class through Maine Health. And I was trying to look that up and I couldn't find it. So I asked Kara for help with that. And it sounds like that class is not free on Zoom anymore.
Yeah, so it sounds like Maine Meds childbirth ed classes are not free any longer. They're starting to charge for those. There's a newborn sleep class that's available. And then if people take the newborn sleep class, they can then take the next level sleep class for older babies. And otherwise, people can reach out directly to the person who teaches the class. Her name is Jenna Marion, and she's with Remedy Sleep. So she is a sleep consultant who is available, but it is not a free resource.
Yeah. So I sent her the information that Kara sent me, and then the information that I have personally for her was to layer up her the things around sleep. So when she's putting the baby down, to do a massage or sing a song, and then the hope is that she can eliminate the nursing part, but do the other layering parts along with that. And then I know about like try and practice sleeping in the crib for naps or in another space for naps without her. But I'm wondering, is there any other thoughts or resources or things that I can share? And there's the IABLE website that has a great handout for parents on sleep. But that's all I could come up with.
That's great. Yeah, and Lynn, if you have that resource link handy by any chance, feel free to drop it in the chat or email it. I'm sure it's something we could probably find as well. Erin just dropped in new bumps and babies flyer. Is that a group, Erin, or is that a sleep?
No, we can finish up the sleep and then I can kind of chime in. Something
Okay.
different.
All right. Yeah, I mean, I think most of you, if not all of you, have had conversations with families about sleep. It is the next most common topic aside from feeding, I think. So it'd be great to share if you have kind of a spiel that you give when it comes to parents having a hard time with their babies sleeping such short intervals. Then yeah, let's hear it. What do you say? Or what resources do you give them? How do you coach them with that? It's
Yeah,
tough.
it's tough. I have one other thing, though, while I have all these great brains in front of me, we are starting to have more non-English speaking families at Penn Bay, Spanish only and French only. And so I have, there's some resources I can find, but it's limited. And like even the birth certificate, I couldn't get that in another language. So any suggestions or thoughts on that?
Great question. Sarah Lowe, I see your hand up. Is this to answer or? Okay. Oh, you're on mute.
Sorry. So actually more to answer about the sleep question. I don't have like a great sleep training resource or anything like that, unfortunately, because it is mostly just random, online courses. What I tell people is I always talk about risk reduction in the meantime while they're trying to sort out their sleep issues. I think that, the way I kind of phrase it to people is co-sleeping is common with breastfeeding. It's not recommended, but, just like when people, when we were talking to people about abstinence with sex, I kind of relate it to that. I'm like, I recognize that, that's what we recommend for prevention. There's other things that you can do to reduce your harm risk. So I always talk to people about the Safe Sleep 7. I always emphasize again, especially I'm a nurse. So, as a healthcare provider, I'm emphasizing I'm not recommending that you co-sleep, but I'm recognizing that it may happen and it might be a challenge that they're facing. So I talk to them about, in the meantime, while they're trying to address their sleep related issues, trying to work out a schedule or things that will be helpful to them. In the meantime, making sure that their sleep environment is as safe as possible. So no heavy bedding, a firm mattress in their environment, no holes that they can fall into, not falling asleep on the couch or the recliner, which has a huge multifold risk. So I recommend checking out the Safe Sleep 7. And then just for providers to have some more information about bed sharing and breastfeeding, the Academy of Breastfeeding Medicine. I don't know how many people are familiar with it, but they have a really good protocol that's put together by many, many providers called the Bed Sharing and Breastfeeding Protocol, which does talk about, again, safety and sleep and just the research around that. So I recommend checking that out as well. And just talking about harm reduction in the meantime while they're sorting that process out and just trying to make it as safe as possible.
Thank you so much, Sarah. Any other thoughts from others on the call about that? Do you say something similar? Do you say something more or different?
I typically add on to that, like in the event that you do find yourself feeling super sleepy, lay down in a safe place, hold your phone on you, and then once baby's asleep, lay them in their bassinet. Just because you're laying down with them does not mean you're sleeping or co-sleeping or bed sharing. But if you're feeling super tired, it's better to get yourself into a safe position with baby. I personally had an experience where I dropped my baby off the bed onto the floor because I was sitting up. I was doing really all the work to not bed share, and she fell off my lap. So like just reminding parents that, yes, it's not recommended, but that there are other risks too if you're not, like, if you're that exhausted.
Thanks, Mitchell. Yeah, it's a conversation, right? There's a lot to it. It's more than just do this, don't do that. It's a lot more around what is reality in terms of following specific recommendations and how to just risk reduction, like you said, Sarah, and like you're saying, Mitchell, is like trying to make the safest experience and situation as possible. Excellent. Great points and thoughts. Erin, I think you wanted to share more about about a resource you put in.
Yeah, just real quick, I think Healthy Oxford Hills might have shared this the last meeting, but we did start Bumps and Babies is really a mom group. We were holding it at Stevens Hospital in Norway without great success, so we moved it to the Norway Library, open for any moms, prenatally or postpartum. And since moving into the library, it's gotten great. So we've had much better success, much better turnout in attendance. So that is open in our Oxford Hills community. I am also working on, right now we offer breastfeeding support inpatient in the Family Birth Center by a per diem lactation consultant. And then our nurses sometimes help fill in, but I'm trying to get us to be able to offer lactation visits in the outpatient practice with CLCs. So that's kind of in progress. If anybody has any experience with patient visits, CLCs in an outpatient setting, I would love to hear from you, and I will put my email in the chat. Thanks.
Yeah, great question. I think you're not alone with that question around how to do that. And I don't know if Lynn is still here or not, but I know this is something that has been, Lynn, are you still here?
I'm still here, but I didn't quite catch that last.
I think looking for some support and information about how to set up outpatient lactation support services, and that's specifically for CLC, Erin?
Yeah, so we have 3 CLCs and kind of between the outpatient OB practice and the pediatric department. And so we're just trying to hope to be able to provide some kind of basic lactation support for breastfeeding families in the outpatient in the event that they can't get inpatient, because sometimes census gets a little bit challenging. And again, our lactation consultant is per diem, works full time overnights at Maine Medical Center. So it gets a little bit challenging sometimes. So we're just trying to kind of boost what support we have. And I know MMP Pediatrics does do this, so I'm going to be meeting with their director to kind of learn how that happens. But if anybody else across the state provides this in an outpatient setting,
so Dr. Ann Witt, WHITT, she's a physician, and she provides information for physicians on how they can provide breastfeeding medicine. But I think you can also, if you can find receptive physicians, you might be able to, that might show a way how to incorporate what the LC care in the office setting, if the hospital is not willing to do that. We at the smaller hospitals, Penn Bay, Waldo, I think even Lincoln Health, do outpatient LC visits, and we are reimbursed for that. So the hospital, so that it is definitely a reimbursable thing. And if you have a space in the hospital that you can use, it's convenient for families to know they can just come right back there.
Yeah. Yeah, Erin, that question around is this specifically around reimbursement for those visits that you're wondering about?
Yeah, workflow reimbursements. As of right now in our family birthplace, we do have patients going to see our nurses that are CLCs. We are not billing for that because as of right now, our director was told that that wasn't something she could do unless it was a lactation consultant IVCLC. So I'm just trying to kind of dig around that process and come up with workflows and how to do it.
Yeah. Are you meeting with Julie Beecher? Is that who you're meeting with? Okay.
Yeah, I think she's away on vacation right now. But she said that she was happy to meet with me as well as a couple of her nurses that are CLCs that provide this level of support in the outpatient practice. So I'm sure that'll be coming soon, which I'm excited about.
Yeah, I would love to have them do a presentation for the coalition because they do have a model that seems to be working really well. And I think a lot of other places would like to emulate that. Sarah, do you have something to add?
Yes. Ashton, you have access to public health nursing in your area because most of them are CLCs and can come right to the home. Also, WIC has, breastfeeding counselors, and as long as your client is a client of WIC, they can access them. So those are two immediate ones that come to mind. But
Yeah, I do use both of them very frequently.
do you have any breastfeeding support groups in your area? No.
Nope, just what I'm offering through the Bumps and Babies, which we always have a CLC at that. There's usually 2 facilitators, and one of them is always a CLC.
Okay.
And Erin, is that group listed in our spreadsheet of support groups? Do you know? And that's just a reminder for everyone too, if you know of any groups that could be added to that spreadsheet that's on our website now for parents to access, please email Heather at North Sky Co. The email address is in there, so we can be adding groups to this list as well.
I believe it is, but I'll double check.
Okay. And hopefully everyone's been able to catch up on the chat box more than I have, but I know that there's been some more resources there, and Casey's been sharing links. I'll have to see if that is, did we find one that works? Are people able to open the link that Casey shared?
There are 2 in there that work. I apologize.
Okay, awesome.
The struggle is real this morning with my Windows 11 updates and my Maine health barriers with using Google. So
Totally
I think I got them.
Yeah. Yeah. And Erin, actually the flyer you sent, it wasn't letting me open that one either. It was bringing me to a Windows page or a Microsoft login page.
Okay, I'll make sure it's on the website. Otherwise, I'll email it over to you.
Okay. Awesome. And then Lisa Shear, thank you. Welcome to Maine. You made it here? You're here now?
I did last weekend. Yes. So it's funny because I think my first meeting was January, and I was like, I hope to be here there someday. And so now here I am. So I am so open to meeting people and learning about things. I have 20 years experience with WIC, so I'd love to connect and just hear about the services and all of that stuff. So anybody feel free to reach out to me. Like I said, we can meet virtually, or I love to meet for coffee too. So I'm just trying to get a feel for the area and what kind of support is available and all that. So my email is in the chat.
Awesome. Lisa at latchingon.com. Thank you. And you also have a Instagram page, right? Social media.
Yes.
You're on there.
Yes.
The work that you've done.
Yep.
Excellent.
Thanks.
Thank you and welcome.
Thanks.
Yeah. Okay. We're at 103. Thank you all so much. If you have anything else, any other questions, any other thoughts, feel free to email me. I'm here if you want to chat, if you want to get any more information anywhere along the line. I'm here at director@mainebreastfeeds.org or info@mainebreastfeeds.org. And I hope you all have a wonderful rest of your week and a relaxing weekend. Thank you.
Do you want to